We're talking about a global state of pandemic still makes sense today, even 2 years and a half after the official discovery of COVID-19?
Without a doubt, we are still in a global pandemic, but there are various phases of the pandemic. There's that very acute fulminant phase in which hospitals were overrun. In the United States, there was a time when we were having close to 1 million cases a day, tens of thousands of hospitalizations, and about 3,000 deaths per day. That's what I would refer to as the acute fulminant stage. But we've come far down, and we're much, much better off now because of a number of interventions, including vaccines, masking, antiviral drugs, testing, the kinds of things that have brought the level down. But if you look at the dynamics of the outbreak, we're still in a pandemic, not the fulminant pandemic that we had last year, but we cannot claim victory yet. We're doing that with a new variant, a combination of the BA2.1, 2.1, and the BA4.5. That will likely peak soon, the way it has in other countries, and then start coming down. So we're in a very unusual situation. We have a variant with a peak, it comes down, another one comes down. Right now, I believe that we are coming in the downslope in some parts of the United States. But the United States is a very, very large country, as you well know, both geographically and population-wise. So there are parts of the country where we've already peaked with this most recent wave and are starting to come down. And there are parts of the country, particularly in the southern states and in some of the western states, where we're still going up. So we cannot say that the pandemic is ended, but we can say that we are much, much better off now than we were last year with regard to the danger of overflowing the hospitals and the danger of a lot more deaths.
Mm-hmm. And what happens with the endemic? Experts usually talk about after the pandemic getting to the endemic. Can we guess a specific date or a month or even a year for that? No.
Clara, that is impossible. And we know every time we try to accurately predict what is going to happen, we get fooled. We got fooled with the big Delta outbreak last summer. We got fooled with the Omicron outbreak in November and December of this year. So the best we can do is to try and prepare for any option. And you do that by getting as many people vaccinated as you possibly can, and you get as many people boosted as you possibly can. And just the same way, I look at the data, Uruguay has done really quite well with vaccines. You're doing better than the United States. You have about, I guess 83% or 85% of your population is vaccinated, whereas in the United States, it's only 67%. Mm-hmm. So we've got to do better with vaccinations than we're currently doing.
Is there you talked about the phases of the pandemic and how each variant brings new challenges and how boosters can be kind of a resistation for that. How can we know the amount of boosters that we can eventually get, or will this become kind of like the flu where we can get a booster every year and continue our vaccination in that sense?
Well, one thing that we do know from experience is that the durability of protection, although it might be high in its quality, the durability of protection following infection, as well as following vaccination, does not last indefinitely. It is limited in its durability, which means although we can't precisely predict what will be required in the future, what is clear that it is likely that over a period of months and years, that we will intermittently need to get boosted to get their immune response back up to the optimal level. It is possible that that will be very similar to what we do with influenza, where every year we give a boost. I can't say that for certain, but I think that it is likely, given what we know now about the durability of response, that this would likely be a scenario that will turn into reality. Right now, we're focusing on getting people boosted in anticipation that we will see a fall surge of cases in September, October, and into November. We don't know for sure if that will happen, but there is a distinct possibility that that will happen. And if it does, we need to be prepared for it, prepared with vaccination boosters, prepared with antiviral drugs, so that those who get infected who are vulnerable for a severe outcome have the availability of antiviral drugs that will prevent them from advancing to a state of disease that will require hospitalization. Mm-hmm. We also need to get more widely available testing. We also need to make sure that people understand that when the level of infection in the community reaches a certain level, it is recommended that people wear masks in indoor settings. I'm not talking about mandating, I'm talking about recommending that people wear masks.
Why is there such an importance between recommending and mandating the mask policy?
Well, because it is very clear that there are many people, particularly in the United States, who interpret mandating as an encroachment on their individual rights, which it really is not. It's really a requirement for the benefit of the entire society. So we would hope that people would realize the public health importance of wearing a mask in an appropriate setting when the level of infection is very low and you are in an indoor congregate setting. You may not need to wear a mask. It might be quite safe without a mask. But when you have a very large dynamic of infection in the community, it would make good public health sense to be wearing a mask indoors.